Why does visceral fat affect bladder health? Imagine your belly is like a balloon filled with fat that surrounds your internal organs. This deep belly fat, called visceral fat, can influence your bladder in several important ways. When you carry excess visceral fat, it increases the pressure inside your abdomen. This extra pressure pushes down on your bladder and pelvic floor muscles, which can make you feel the urge to go more often and even cause leaks. It can also reduce how much your bladder can hold comfortably, leading to frequent trips to the bathroom. Visceral fat is not just sitting there, it's metabolically active. It releases substances called cytokines, which are chemicals that promote inflammation. Chronic low-grade inflammation from these cytokines can interfere with how your bladder muscles and nerves work. This disruption can make your bladder muscles overly sensitive or hyperactive, a common feature of overactive bladder. When your bladder nerves don't function properly, you might experience urgency or difficulty controlling urination. Another key factor is that visceral fat is closely linked to metabolic syndrome. This condition includes insulin resistance, high blood pressure, and abnormal cholesterol levels. Metabolic syndrome causes systemic inflammation that can further impair bladder function. Studies have shown that the more visceral fat you have, the more likely you are to experience worse bladder symptoms, regardless of your overall body weight. This means even if you are not very overweight, having excess visceral fat can still impact your bladder health. Visceral fat also affects the nerves that control your bladder. The inflammatory substances and metabolic changes can impair neural signals, leading to abnormal bladder contractions and increased urgency. This can make daily life more challenging and uncomfortable. Research supports these connections. People with higher amounts of visceral fat tend to have more severe overactive bladder symptoms, lower urine flow rates, and more residual urine after voiding. The good news is that reducing visceral fat through healthy weight management can help improve these symptoms. Losing visceral fat not only benefits your overall health but can also lessen bladder problems caused by excess belly fat. In summary, visceral fat influences bladder health by increasing pressure on the bladder, promoting inflammation that disrupts muscle and nerve function, and contributing to metabolic issues that worsen urinary symptoms. Managing your weight with a focus on reducing visceral fat through balanced diet and regular physical activity is a practical and effective way to support bladder health. Always consult with healthcare professionals for personalized advice and treatment options tailored to your needs.